The latest information about aspirin came out recently and caused some confusion among some patients. The first thing to understand is that there are two types of prevention of disease in medicine. There's primary prevention and secondary prevention. And in the situation with aspirin, with secondary prevention, those people who had heart attacks and strokes, there's no evidence that stopping aspirin in this age group, you should stay on your aspirin unless your doctor tells you to stop it. Aspirin is a medication, so kind of considered the miracle drug among miracle drugs. It helps prevent pain and swelling and other issues it helps with, but the major benefit from a health standpoint is to prevent the inappropriate clotting of platelets in your bloodstream, which can lead to stroke and heart attack. So for many years we thought every patient should take aspirin every day. We've since learned that there are two different groups of patients, and there's patients who've had heart events or strokes, which we call a secondary prevention patients. These are patients who should stay on their aspirin every day, and these guidelines have not changed with this group of patients. And that's an important change because a lot of our patients have come to us and said, I heard I should stop my aspirin now. The second group of patients is what we call primary prevention patients. These patients have never had a heart attack or a stroke, but are on aspirin every day to help prevent these events. And it turns out, despite the logical idea that this would help prevent these events, and indeed some events are prevented, unfortunately aspirin has side effects such as bleeding and sometimes catastrophic bleeding, which leads to equally adverse events. So in the high-risk groups, those patients who've had heart attacks and strokes, the guidelines have not changed at all. In patients who are considered high risk but have never had a heart attack or a stroke, those patients should discuss with their doctor whether they should stay on the medication or not. And that's been the big change in the guidelines that recently have come out.